Hello, my name is Jaden Gillum, and today I will be performing the skill of discontinuing a IV catheter. So I will make sure to abide by all GSPS practices, and first things first, I would prepare all my equipment, my gloves, my tape, and my gauze. I have that all right here. I don't have gloves, but we're pretending. The next thing I would do is I would check my orders, make sure that I'm taking out the correct IV. I would identify my patient using 2 patient identifiers, their name and their birthday. I would stop the flow of any IV medications currently ongoing. The next thing that I would do is I would perform hand hygiene, put on clean gloves. Then I would assess the IV catheter site for any blood, swelling, drainage, or any other abnormalities the patient may be experiencing. The next thing that I would do is I would support the hub to make sure that it's not moving around when I remove the tape. So just remove all the tape. Removing all the tape, making sure that I'm being gentle with my patient and still continuing to support the hub. Switching hands here to get this bottom tape off, continuously supporting the hub, and then I would grab my gauze, apply pressure proximal to the insertion site, then I would slowly and gently pull out my IV catheter. It's stuck. There we go. Okay. Then I would place this over here. I would hold pressure for just a few minutes until the bleeding stops. And then once the bleeding is stopped, I would get a new gauze and place it on this site. And then I would get some tape, if I can get it. And then tape the gauze to the patient's incision site. Okay, that's that. And then once that is finished, I will inspect my IV catheter, making sure that the cannula is still there, there's no damage, it's not missing, and it's all there. I would dispose of this in the correct biohazard container. The next thing I would do is I would remove my gloves, perform hand hygiene, and then I would just document and record per my facility's policy.